medical director of an IVF clinic called Nurture in West Delhi, which is part of the state of Delhi. And I'm also attached as a obstetrician and gynecologist to various hospitals like Shalimar Bagh and Apollo Cradle Hospital and CK Birla Hospital. As as we gather here today, we are hoping to discuss um, various aspects of high risk pregnancy. And it becomes all the more relevant to discuss this because, as all of us know, there has been an unfortunate incidence of a pregnancy induced hypertension patient who was a 35-year-old 31-week pregnant Indian tourist who passed away in Portugal. And this has kind of, raised worldwide the interest in pregnancy per se and the high risk nature of pregnancy, which looks so much like a physiological phenomena. So, um, discussing some of the aspects of high risk pregnancies like hypertensive pregnancies, twin pregnancies. The first question that I would be addressing today is, it says that I'm suffering from preeclampsia with a twin pregnancy. What care do I need to take besides medication? Now, as most of us know, that twin pregnancy per se is a high risk pregnancy. And twins, whether they are conceived spontaneously or are conceived as a result of any kind of ART treatment, they are at higher risk of having preeclampsia and eclampsia than the general population. So it's one of the high risk factors for preeclampsia. Irrespective of whether you're a twin pregnancy or a singleton pregnancy, if you have preeclampsia, it is a condition to be treated with extreme um, extreme care in terms of medication, adequate rest, watching out for symptoms of precipitation of eclampsia or deterioration of preeclampsia. So, if you have sudden blurring of vision, or you have a sudden onset headache, or you have pain along the area of the liver, or you feel that you're getting a prodrome of something not working well, your urinary output is less than normal, or suddenly your hands and feet swell, or you feel the baby's movements are less, or you have a specific severe backache accompanied by bleeding or spotting. These could all be signs of increase in blood pressure, precipitation of preeclampsia, and onset of eclampsia. So, if any of this happens, please report to your healthcare provider. A high protein diet, adequate calcium supplementation, regular visits to your gynecologist, and adequately informing abnormal symptoms to your gynecologist will be usually very helpful. And these are things that you can do at home. Less table salt, पापड़ अचार चटनी जो बहुत ज़्यादा हाई सॉल्ट फूड्स है उनको अवॉइड कीजिए. Avoid using table salt on your food and salads, etc. So these are some of the things that one can take care of at home with preeclampsia and any pregnancy, be it a singleton or a twin. The next question that I'm addressing, it says, I'm a 4-month pregnant lady with a short cervix and I'm on complete bed rest, but what extra care do I need to take? Well, if you have a short cervix, one of the things you could discuss with your healthcare provider is the need or the appropriateness of putting a cervical cerclage or a McDonald's stitch, as it is commonly called. It is a kind of physical barrier which keeps the mouth of the cervix closed and sometimes is usually is very helpful. Other than that, loading yourself with progesterone, oral, vaginal, injectable, as your healthcare provider thinks right, may be a useful tool to prevent preterm labor. If you have abnormal symptoms like increased in cervical discharge, a sudden onset of vaginal discharge, pelvic pressure, too much cramping, then report to your doctor. And little measures like drinking a lot of fluids, having a high protein diet, getting yourself fastidiously screened for vaginal infections. These are little things that you can do at your end. And if and when you have any of the symptoms like excessive discharge or clamping or pelvic pressure, it's time to consult your doctor straight away. So these are little things that you can do at home to ensure that your pregnancy moves smoothly. Now, somebody wants to know what are the things to do for a normal delivery. Well, to ensure that you have a easy normal delivery, perhaps amongst the things like taking a regular planned antenatal care program, things that you can do are keeping yourself active in pregnancy, taking regular walks, doing regular exercises. Obviously, these exercises have to be under supervision, ensuring that you don't gain too much or too little weight during pregnancy. Um, Little things like yoga during pregnancy may sometimes be very helpful. Taking Lamasic classes may be helpful, but more than that, it's a having a mindset preparing yourself for vaginal delivery. Secondly, being physically active and ensuring that you don't have any contraindication to a vaginal delivery. These are some of the things that you can do to aid in delivering vaginally when you are in labor. Another question that I'm going to address is I'm suffering from asthma for the last 10 years and experience frequent asthma attacks during pregnancy. Will that affect my fetus and how can I prevent it? Well, a lot of changes physiologically in the lungs in a pregnancy, especially an advanced pregnancy, can sometimes simulate somewhat symptoms close to asthma. So, like shortness of breath, a little bit of breathing difficulty can happen because there's a collapse in the peripheral alveoli in during pregnancy. There's a decrease in the tidal volume because of the pregnant uterus. So, some early symptoms of asthma and advanced pregnancy can sometimes mingle. So, you need to be careful. Avoid all things that precipitate your attack of asthma. Do not undermine the importance of taking your inhaler or your rotahaler. Whatever you take, these are drugs which are relatively safe. And if your healthcare provider has given you these medications, I'm sure she understands the need of the medications. Their side effects, if at all there are any, will be taken care of by your healthcare provider. So don't stop using your medication. And if you are having frequent symptoms, a chest physician or a physician will be a useful person to sort of keep consulting and taking regular tips from. Deep breathing exercises, spirometry, sometimes taking steam, these are little things that can be helpful. And of course, gradually building your lung capacity with deep breathing exercises and taking exercises during pregnancy can sometimes be very useful. Usually, unless the attack of asthma is so severe that it decreases your oxygen carrying capacity dramatically, it should not have an in effect on the fetus. And to be able to, prevent yourself from getting to that point, if you're on regular medication and you're regularly in touch with your physician and gynecologist, I don't think that situation should ever arise. Um, the last question, perhaps, is I'm suffering from high cholesterol and I'm 4 months pregnant with a BMI on the higher end. What precautions should I take? Now, in the current medical practice, there is really no role of measuring cholesterol during pregnancy for the simple reason that cholesterol during pregnancy has really no estimation. Usually, people will have a high cholesterol, HDL, LDL, triglyceride during pregnancy because of the physiological changes of pregnancy. The sex hormone binding globulin, which is like a carrier molecule for a lot of hormones, rises uh, quite a lot during pregnancy, and that kind of resets the thermostat for the cholesterol levels. So really there is no indicator to say what level of cholesterol is normal for a pregnant woman and what is not normal for a pregnant woman. So if your cholesterol levels in pregnancy are slightly raised, I don't think there's any cause for panic. If you have a known hypercholesterolemia prior to pregnancy, your physician and your obstetrician will probably be able to tailor a treatment ideal for you. Obviously, avoiding too much of fat, too much of saturated fatty acids like butter, ghee, the dalda. I mean, these sort of foods are to be avoided, and including almonds, fish in your diet, including vegetarian forms of proteins can be helpful. And if your BMI is a bit on the higher side, ensure that you have an optimum weight gain during pregnancy. Don't go overboard with food. Taking a dietitian and a physiotherapist with you in the loop along with your obstetrician can tailor an exercise and a diet program which would be specific for you in such a way that you don't gain too much weight, but the baby continues to have an appropriate weight gain. And I think that should be enough. To wrap it up, I'd like to say pregnancy, we all know, is a physiological phenomena. So many of women in times before ours have delivered at home and are still continuing to do so. But what may seem like a very simple, very physiological phenomena, if unsupervised, poorly controlled, purely taken care of, can sometimes take a very serious course, especially with respect to conditions like malnutrition, anemia, hypertension, preeclampsia, as we discussed, thyroid during pregnancy, gestational diabetes or pre existing diabetes in pregnancy, um, ART conceived pregnancy, multiple pregnancies. These are all high risk situations, and they should be managed under supervision with appropriate antenatal care and are not to be taken lightly. There is no merit in staying away from a doctor's supervision, as you know, feeling that ये तो बिल्कुल नॉर्मल फिजियोलॉजिकल फिनोमिना है, मेरी दादी ने घर में डिलीवर किया, मेरी मम्मा ने घर में डिलीवर किया. We are in an era where we do not take maternal mortality lightly, and every country has a goal of reducing its maternal mortality. In fact, in most of the Western world, if there is a mother who dies during her pregnant or immediate post pregnant period, it is something to be, where the most of the heads, the health experts and the heads that make the policies get together to see how their policies went wrong, where they went wrong, and where they can do better. So any young morbidity or mortality is something to be condemned. And a very simple way to take care of it is to understand what is normal in pregnancy, what is not normal, how to be able to sift out as a patient what is right for you, what is not right for you. And for this, I think a fair amount of counseling with your obstetrician during your antenatal period will be very useful. So enjoy your pregnancy, but do not take it lightly.